enjoy an update on the International Alliance's Information and Technology Committee from my colleague and friend from England, Nick Goldup. Thank you, Nick.
Hi again, everybody. Lovely to see you. Thank you for the opportunity to update you all on the work of the Innovation and Technology Advisory Committee, or ITAC for short. It's a really exciting area of work and one that I'm really very passionate about. And also thank you to Stuart for that presentation. And working with Stuart and Rolls-Royce and the think tank, it's just been a complete delight and pleasure. So thank you for your time today. My name is Nick Goldup and I sit on the board of the Alliance and I chair the ITAC group. And I've got a few minutes just to introduce you to the work we're doing before a few of my colleagues take over. So let's go back a year. Let's go back to the lovely warm climate of Perth a year ago. And at that meeting in Perth, the Alliance board agreed that technology was playing a bigger part in the lives of those affected by MND and ALS, and there was a great opportunity to become more involved in technology for the benefit of our community. And discussions across organisations globally and have been sort of provided an opportunity to consider this area of focus. And we've been engaging with some big names in technology, as we've just heard from Rolls-Royce in the UK. And across a few other countries where similar sorts of work had happened and created similar networks. And actually, on that note, do contact me if you'd like to chat further on any of that sort of think tank work that you've just heard about. The Alliance therefore agreed to form the ITAC committee earlier this year to focus on making recommendations regarding technology and innovation. And we thought that this could cover three areas really. Firstly, to provide expertise, input and lived experience for the appraisal of technology streams of work. Secondly, to provide steer and expertise to new technology ideas and projects that are either presented to the Alliance or ideas developed by the Alliance. And finally, to provide guidance on future technology strategies and aims and investment potentially that we may want to do as a board of directors. So we're very, very fortunate to have the time and dedication of a terrific board representing the lived experience of people with MND and ALS. The organisations within the technology sphere sit on that board as well. And we're very grateful for their time this year helping to set up the committee and provide that focus. So that's the theory, but what are we up to? Firstly, as we all know, the utilisation of technology to support people with MND and ALS covers a vast area, from communication devices to wheelchairs and from environmental controls to virtual reality. So we wanted to focus on the MND patient journey with the disease and how technology aligns with this journey. Just to mention that work on the patient journey using the Canada model is planned in the workshop session later today, which will provide us in the ITAC with a roadmap of opportunities for the committee to use going forward. However, impatient as we are, we started work already by forming a subgroup of experts from the speech and language world to develop a decision-making framework which ultimately supports people with MND and ALS to understand the choices available to them. So in other words, for people to understand what technology options they have at different parts of their journey with the disease. And I'm pleased to say the brilliant John Costello is chairing this group, and we're going to hear from John shortly on that piece of work. What I will say about that project, though, is that it's not a tool to replace clinical decision making, but instead an aid to making informed choices for people with MND and ALS, and also for healthcare professionals as well. So this, in essence, will be a web-based platform, and I'm really pleased to say that we've started developing this platform with the wonderful experts from the University College in London and Microsoft as well. And we will be hearing from Jessica Hong and Richard Cave on this work very soon. However, I hope you agree that those two organisations, the UCL and Microsoft, are organisations that are wonderful to be working with. So this is very, very exciting, something I hope will provide people with MND, as well as healthcare professionals, a better understanding of technology for their needs, and really importantly, greater choice. The future is really bright for the committee, and it's relatively early days. We've a wonderful opportunity to shape this area of support for people with MND and ALS, hand in hand with big names in technology and, of course, big names within our health professional landscape. So it's a very exciting time. I've probably said exciting far too many times, But thanks for the opportunity to provide this introduction, and it gives me great pleasure to hand over the reins to Jessica and Richard to update you on the UCL APP project.
All right, off we go. So, hello, my name's Richard Cave, and I'm a speech language therapist, and I work with the MND Association here in England. And I'd just like to, would you mind introducing yourself, Jessica?
Of course. Hi, everyone. I'm Jessica Hone, and I'm a final year student from University College London, and I am currently working in collaboration with Microsoft UK and the International Alliance of ALS MND on this project.
Lovely. Thank you, Jessica. So we're here to tell you about a really exciting project that's being run by the International Alliance of ALS Associations. The project team is made up of an international group of speech therapists, occupational therapists, physiotherapists, and assistive technologists based in the US, Canada, Australia, and here in the UK. We're partnering with University College London through what's called the Industry Exchange Network Programme. And Jessica is actually being mentored on this project by a senior manager from Microsoft throughout her assignment. So what are we going to do? We are going to build an online platform that will be like a TripAdvisor for assistive technology. It will provide information about assistive technology that people living with ALS may consider using at different stages of their progression. And if people living with ALS have used any of that assistive technology, the platform will provide an opportunity for them to share their experiences, the good, the bad, or the ugly. People can easily navigate the website by answering a series of questions based on why they visited and what they want information about. So ahead of the technology, what are the benefits? The benefits are it will benefit people living with ALS by providing them with an easy way to explore the variety of products available for their different needs, and to give them the opportunity to hear the opinions of other people living with ALS and share their own. It will benefit professionals working in the area by helping them explore the different products available in a particular space. As a speech therapist myself, even though I have specialized in the ALS in this area for a long time, the area is so broad that I really only have practical experience of some forms of assistive technology, but not all. And finally, it will help the suppliers of the assistive technology themselves to improve their products by hearing feedback from the people that use their stuff. We believe unvarnished feedback will drive product innovation and improvement. One thing to say, this is not a replacement for professional advice. We emphasize that people living with ALS should discuss with their professional team their needs for assistive technology. Our website will only provide general information and is no substitute for professional advice and cannot make a personal recommendation. However, we believe more information for all is a good thing. Our platform will help everyone with more information about the different types of assistive technology available and enable a more balanced discussion between people living with ALS and their professional team. And most importantly, provide a voice for people using assistive technology to give their feedback. So our first task over the next few months is to build a proof of concept. We will build the platform focusing on one area, voice banking technologies. We will invite people living with MND in the UK to feedback on the voice banking products that they have used. Even within this limited scope, we are already getting a lot of interest. Voice banking is very popular in the UK. So far this year, over 750 people have banked their voice, and more than 800 professionals have been trained by the MND Association to support people living with MND. This is going to be the first dedicated space where people living with MND can find out about all the available voice banking services and provide feedback on their experience of voice banking and what they did next with it. If they liked it, if they used it, if they would recommend it. Our platform, even in proof of concept, will provide novel and useful insight that will help people living with MND, professionals and suppliers alike. I'd like now to hand over to Jessica to show where we are with the design, and I invite you to get in touch to ask us any questions, and I very much welcome your comments and feedback. And I shall stop sharing and hand over to you, Jessica.
Thank you very much, Richard. I will bring up my slides. Thank you, Richard. That was brilliant. And I present to you now more details about our information and review platform that we are trying to build. So first, a short introduction of the purpose and motivation that brought to our project. So ALS and or MND patients have an average life expectancy of between 2 to 5 years from the onset of symptoms. And symptoms caused by the degeneration of motor neuron cells include disabilities in their mobility, speech, digestive systems, and some of the respiratory systems of the body as well. And these systems can develop very rapidly at different times of their phase of the disease. And this means we need a quickly adaptable system to provide the necessary services and guidance for our people. This is also in line with the purpose and motivation of the Alliance and has inspired the initiation of this project as a result. So this particular work focuses primarily on assistive devices available to the ALS MND market. Assistive devices play an important role to make the journey as convenient and comfortable as possible. However, with the large range of available products in the market out there, it becomes unintuitive of what would be the most appropriate and cost-effective devices to serve the purposes and needs of our users, which can in turn lead to unnecessary anxiety and economic burden on not the patients, only the patients themselves, but also their family, friends, clinicians around them who are trying to helping out. This project is designed in the hope that what we are delivering will fill this gap and help our people to make better and well-informed decisions. As the intended outcome of the project, the team is looking to provide an information system application where it serves a similar role to a clearinghouse of information. It acts as an additional source of information available assistive technologies and aim to provide some guidance in the decision-making process. As Richard also mentioned earlier, it is not intended to do a replacement of the healthy patient-clinician relationship that they might be having now, but rather just to enrich their clinical conversations for the better of the patients, as well as descriptions of the technologies that we will be displaying on our application. And distinct feature the platform will be having is the power of the community feedback. The platform aims to gather independent reviews and ratings from peer patients or other stakeholders who may have personal experiences with the technology, and they would be able to provide firsthand direct feedback on things that other people who have lots of common ground with them are wondering about exactly. And this also provides a great opportunities for suppliers to directly improve on their products. On the other hand, fundamental functionalities such as free browsing of the application, searching interested technologies, and using our feature matching assistance device is also available as part of the product. So far, we have looked at a very ambitious outlook of the project, but we have to consider the time limit posed by the scale of the UCL project, unfortunately. So to make things more manageable and achievable within the time frame, the team adopted a minimum viable product approach, where we will deliver the most basic foundation of what we have posed so far that could be taken away for further developments. All the necessary functionalities will be implemented, and the design could be flexibly adapted to suit any new data and inputs in the future. Technology, being the key word here, is the first element we looked at iteratively to limit our scope down. And in one of our last updates, as Richard just said before, it has been finalized to be a specific focus on the voice banking technologies, which is very popular among the patients. Another point of consideration was the size of our audience. Instead of the vast global market, which could be the final goal the project is aiming for, we first brought it down to the 3 regions, namely US, UK, and Australia. However, another concern that emerged from our group discussion was the regional differences and funding differences that might be existing in between or even within the country, say United States. Therefore, we concluded that we will look at the unified medical system within the UK, namely the National Health Services, as a good starting point. The project kickstarted during October when I first met up with the team, and that is also the time when requirements gathering and data collection started simultaneously. By the end of October, I have produced a formal project plan, and we have regular meetings set up to ensure everyone's on the same page with the progress. We can see that at this time of the year, I have just completed a literature review, which I'll spend a little time talking about later. And the system design stage is also wrapping up as well. The next step is the reviewing of choices of technologies that will be used for system implementation, and a milestone in January of producing an interim report to track substantial progress is being made to fulfill the completion of the project properly. So the literature review that I just mentioned, as its name suggested, is a review of the related existing work of clinical review sites and other technologies. An analysis was conducted to identify differences and the gap in the market where our information platform would really fit in. Some web-based review sites and relevant decision tree framework functionalities are being investigated. So some considered features in this analysis include the reviews and rating system, such as how big is the scale of the data included and how reliable are the data? Do they have a review policy? Also, the presentation of the information. Do the web pages have a clear layout? And is navigation easy for different sections of information? Ease of use is very important in our application design, especially for our target audience, where accessibility and usability is a very important factor to consider. So these aspects are looked at, but without going into too deep technical details and specific implementation behind the application or websites, because they are always flexible. Last but not least, I present to you with some insights gathered from the literature review, the SketchUp of the outline of the interface design and the system architecture on our application. So here is the welcoming page of our application, where we can see a clear layout of the list of technologies that are available in the market. And the patients could navigate around the web page by clicking on different tabs within the navigation bar to direct them to the bigger categories of different technologies. We've also implemented a login function. However, it is not it is not necessary that they are a registered member in our system, and we will have this later on in our user case diagram as well. This would be an individual technology page layout of our specific technology, where we can see the reviews and ratings of the community feedback very clearly, as well as an overview of the technology itself. Here is the assistive technology process decision-making team framework that we will be having as part of our application as well. And this is aimed to help our patients and other stakeholders to make better decisions through answering a series of questions that will clarify their needs and goals for visiting our applications today. And here's another user case diagram where we can see, again, the users don't have to be registered in order to benefit from all the functionalities that are available to our application, such as browsing the reviews and searching interested technologies they might want to take to their conversation with their clinician next time. Thank you for listening.
Thank you, Jessica. That was great. Thank you. I will just close by just saying, really grateful to everybody working to help us with this project. And if you anyone that's listening and watching this, if you have any questions or feedback or comments or ways that you think you could help, we very much welcome that. And there's my email on the web page, but please get in touch, because we would love to hear from you. All right, thank you so much.
Thank you.
Thank you so much to Jessica and Richard. I really love this project. I think it's such a great opportunity for us to provide choice, and the TripAdvisor tool, I think, is something which will give real be really powerful. So I'm just going to field some questions for you. I'll start with the first one, if that's okay. Just in terms of the application, would it be a web-based application or an app, or both?
Go on, Jessica.
Sure. So as our initial kind of proposal, the application will take the form of a website. So it's a web-based application. But as it was mentioned in an earlier presentation as well, that sometimes it is a problem that we're facing, that internet connection might not be ideal in some locations. So for our next step in future development, for sure, we will be considering some offline format and a kind of alternatives to this online kind of application format to provide more kind of accessibility and information system for our people.
Thank you. There's a few comments in the chat around speed of voice banking. So this is more a question about voice banking. I think Richard probably could answer around the speed of voice banking.
Yeah, I think this is a very exciting area, and there's been a lot of technology change recently, and certainly. If we were talking a couple of years ago, then certainly volunteers working with the MND Association to help people to bank their voice, the average time for somebody to complete their voice banking was about 3 months. Things have changed very significantly since then, and I'd like to, I actually put in the chat that people can, given a fair wind, they can just get it done the same day, and actually it can be even faster than that. It can be done. If everything is working well and everyone's feeling good, and you can get it done in a session, in a speech therapy session. So I'd like to think that the MND Association and other teams around the world have influenced the voice banking providers to kind of align everybody on actually what the needs are for people with MND. Banking, voice banking in 3 months is just a huge task, and a technical task as well. What we want is just to get it done and then move on. And this is a complex area, and that's why I'm so happy that the initial scope for this very exciting project is around voice banking, because here in the UK and globally, I think there are no less than 7 voice banking providers, and they make all sorts of claims and various things, and it's just a difficult area to manage. And actually what's missing in this whole field is the voice, is kind of feedback from people who've been through the voice banking and what happens next, and what are their views. We hear from the suppliers, but what are the people living there? What's their feedback? And it's just a really good project, because it's going to, all that good stuff's going to feedback. And I hope that the the market for voice banking will improve. The suppliers will know who they're working with a lot better, and it will just get better for everyone. It's certainly the case that voice banking is extremely popular, and it's only going one way. I mean, it's the growth this year was at least double from last year, and it was double the year before. So, and so it should be. So people should have a choice to bank their voice. Let them have the information, let them make their own call, and let's give them the support.
Thank you, Richard, and thank you, Jessica. There's a few other comments in the chat which please do have a look at, but I think for now we should probably move on. But thank you for that. I'll also just mention at this point that there's an opportunity to hear about the work that the ITAC have been involved in with Microsoft and Google at the APF meeting. So please do have a look at that if you're signing on to that meeting.